Curcumin is a well-studied and versatile supplement extracted from turmeric. Some conditions that may benefit from curcumin are allergic rhinitis or hay fever, depression, high blood fats, non-alcoholic fatty liver disease, osteoarthritis, pruritus or itchy skin. Note: turmeric has low bioavailability. Taking regular curcumin supplements will unlikely provide benefits outside of the gut. Turmeric, or curcuma longa, is most commonly known as a spice found in curry. It's not only known for its flavour, but its purported health benefits also. According to the National Centre for Complementary and Alternative Medicine, there's a lot of research about turmeric or curcumin, including human studies for a variety of health conditions. Turmeric contains several major constituents known as curcuminoids, and these typically make up about 3% of its weight in commercially available preparations. Curcumin is known to be the most active phytochemical of the 4 curcuminoids found in turmeric. It makes up 77% of the total curcuminoid content. The remaining 3 constituents typically come in at 17% des-methoxycurcumin, 3% bis-d-methoxycurcumin, and the remaining, more recently identified curcuminoid, cyclocurcumin. Some of the benefits of curcumin: it may reduce inflammation, it may help balance the immune system, it's good for detoxifying, and it's likely safe. Research suggests that specific turmeric extracts alone or in combination with other herbs may reduce pain and improve function in people with knee osteoarthritis. 3 months of supplementation with 200 milligrams per day of a curcumin phosphatidylcholine complex decreased pain scores by 58%, and it increased walking distance by over 400% in osteoarthritis. Curcumin has also been researched for its potential to regenerate cartilage. Some clinical trials suggest that 2 months of curcumin supplementation of 500 milligrams per day can reduce hay fever symptoms like sneezing, itching, runny nose, and congestion. The authors proposed that curcumin helps to balance the immune response. A recent review of clinical trials suggests that curcumin reduces depression symptoms as an add-on in people who are already using antidepressants. The effect of curcumin appears to be greater for middle-aged people compared to older people. Better effects were also seen in people who supplemented for at least 6 weeks and who used at least 1 gram per day. Additionally, various curcumin formulations were used in the studies. They all had similar effectiveness, although one specific formulation, BCM95, seemed to offer a non-significantly greater benefit to people with depression than the typical curcumin piperine formulations. Additional studies should look into various curcumin formulations for this. In older people, curcumin improves sustained attention, working memory, and mood. Scientists are investigating whether curcumin affects the development of new cells and brain-derived nootropic factor stores in the hippocampus in chronically stressed rats, which is a model for depression in animals. Other active areas of research are looking into the effects of curcumin on blood cortisol levels and cortisol sensitivity, the glucocorticoid receptor expression, NMDA and 5-HT2C receptor activation, and glutamate activity in the brain. In mice, potential interactions and synergistic effects between curcumin and piperine and SSRI and SNRI antidepressants are also being researched. Clinical trials suggest that curcumin can reduce markers of liver injury and liver fat buildup in people with non-alcoholic fatty liver disease. Scientists are exploring curcumin's non-alcoholic fatty liver disease related mechanisms in animals and cells. Some hypotheses suggest that curcumin improved the non-alcoholic fatty liver disease by raising leptin sensitivity, inhibiting obesity-induced inflammation, and by lowering LDL cholesterol and triglycerides. According to clinical trials, turmeric at 500 mg orally 3 times per day for 8 weeks decreases the symptoms of itchy skin or uremic pruritus in patients with end-stage renal disease. Early clinical findings also suggest that curcumin reduces pruritus severity and it improves the quality of life in patients with sulfur mustard-induced chronic pruritus after daily use for 4 weeks. The effect of turmeric on cholesterol levels are mixed. Some studies suggest that turmeric lowers the bad cholesterol LDL and the triglycerides, but it doesn't affect the total cholesterol or the good HDL cholesterol. Another review suggested that curcumin improves HDL but doesn't affect LDL. Future studies need to clarify the conflicting findings here. Based on the available evidence, it's possible that curcumin has no effect on peptic ulcers. Existing studies suggest that curcumin doesn't improve radiation dermatitis, which is a type of skin damage and irritation caused by radiotherapy. Existing evidence doesn't support the use of turmeric in patients with Alzheimer's disease. In a small trial, 1 to 4 grams per day of curcumin for 6 months had no effect on the mental and cognitive state in patients with Alzheimer's disease. A meta-analysis of studies revealed that turmeric groups may have experienced greater cognitive decline when compared with a placebo. Data is limited by the small sample size and the patient variability, but there's enough evidence to advise against using turmeric in people with Alzheimer's. These findings outline how a compound can have completely different effects in animals than in live human beings. It should serve as a reminder that animal findings should always be interpreted with extreme caution and healthy skepticism. Prior to the above-mentioned clinical trials, many animal experiments suggested that curcumin can reverse cognitive decline, memory deficits, and inflammation in animal models of Alzheimer's disease. Various mechanisms were proposed, like increasing neurogenesis, brain-derived neurotrophic factor, and CREB, yet curcumin was a failure clinically. In patients with rheumatoid arthritis, 500 mg of curcumin and diclofenac sodium was found to be effective for joint pain and arthritis. Low-quality evidence suggests that curcumin may reduce bowel movements, diarrhea, and stomach pain in people with Crohn's disease after daily supplementation for 1 month. According to preliminary research, in lupus patients, short-term turmeric supplementation decreased blood and protein in the urine along with systolic blood pressure. Preliminary data suggests that curcumin improves cardiovascular function and it reduces oxidative stress in diabetic patients. A 9-month curcumin intervention significantly lowers the chances that prediabetes develops into type 2 diabetes, potentially improving the overall function of pancreatic cells. Curcumin reduced the severity of PMS in a very small human study. Researchers are investigating the effects of curcumin in animals and cells on bile release from the gallbladder, multiple sclerosis, rheumatoid arthritis and psoriasis, inflammatory cytokines, viruses like influenza, Candida albicans, septicemia in mice who were exposed to pathogenic bacteria that were responsible for cholera, lung inflammation, brain cell death, glutathione levels, insulin receptor protein levels, and oxidative stress. Curcumin is being researched for activating the vitamin D receptor, which might be important for combating infections. With the brain and DHA, one of the interesting things that scientists are investigating about curcumin is its potential effect on the brain's DHA levels. In cells, curcumin elevates the enzymes involved in the synthesis of DHA from alpha-lipoic acid in both liver and brain tissues. This may turn out to have a significance since fish oil DHA supplements sometimes doesn't increase the DHA in the brain. However, curcumin may turn out not to affect the brain's DHA levels in humans at all, We simply don't know yet. The effects of curcumin on metal toxicity in humans are unknown. Curcumin decreases inflammatory markers in copper overload rats, and it reduces aluminium-induced inflammatory responses in rats' brains. Cell studies are investigating its effects on DNA damage from arsenic, mercury, fluoride, and excessive selenium. In mercury-exposed rats, curcumin reduced the oxidative stress. In iron overload rats, the curcumin decreased iron accumulation in the liver and the spleen, and it restored antioxidant levels. Curcumin enhances erectile function in diabetic male rats. Curcumin lowers blood sugar, improves insulin sensitivity, and reduces urine sugar in diabetic mice. In animals, scientists are studying if curcumin can lower blood sugar by stimulating insulin secretion from pancreatic cells, if it affects pancreatic regeneration, if it affects muscular insulin resistance, or obesity. Bioavailable curcumin delays cataract development in diabetic rats. It alleviates diabetic cardiomyopathy in diabetic rats. Studies are investigating whether curcumin lessens diabetic complications in rats' brains, slowing mitochondrial dysfunction. In cells, scientists are studying if curcumin activates AMPK in muscles, leading to the increased glucose uptake and inhibiting new growth and formation of fat cells. Other researchers are looking into the effects on muscle tissue generation and healing after injury. Some researchers consider curcumin to be an oxygen radical scavenger. According to one hypothesis, it acts as an antioxidant by increasing glutathione levels, and as an anti-inflammatory agent through inhibition of interleukin-8 in lung cells. Scientists are exploring its effects on the following pathways in animals or cells: lipid peroxidation and levels of glutathione, superoxide dismutase and catalase, levels of vitamin C and E and DNA damage, gene expression and enzyme interactions, blood inflammatory markers, chronic fatigue and prostate inflammation, alteration of the mTOR pathway and Tregs, mast cells, DAO and histamine levels, and cholinergic activity and nicotine binding ability to the alpha-7 N-acetylcholine receptor. In early phase clinical studies, a combination of curcumin and docetaxel, a chemotherapy drug, was shown to be safe in 14 advanced and metastatic breast cancer patients. Curcuma extract appeared to be safe in a small trial of patients with colorectal cancer. Given to colorectal cancer patients during the pre-surgery waiting period, curcumin improved muscle wasting and general health. Preliminary data suggests that it might reduce the number of precancerous rectal abherent cryptifoci in people who are at high risk of colorectal cancer. Curcumin has mostly been researched in cancer cells. Remember that many substances have anti-cancer effect in cells, including toxic chemicals like bleach, but this doesn't mean they have any medicinal value. On the contrary, most substances, natural or synthetic, that are first researched in cancer cells fail to pass further animal studies or clinical trials due to a lack of safety or efficacy. With this in mind, scientists have explored the effects of curcumin on the following pathways or the types of cancer cells in dishes or on animals: brain cancer, such as glioblastoma, and oral cancer cells; T-cell lymphoma, melanoma cancer cells; cancer cells of the mitochondria; breast cancer; colon cancer; activity in combination with EGCG catechin in lymphocytic leukemia cells; lung cancer cell with inhibition of interleukin-8; prostate cancer cells; and pancreatic cancer cells. In animals with alcohol-induced oxidative stress, curcumin was researched for reducing inflammation, lipid peroxidation and liver damage. It was also studied in rats with kidney injury or Tylenol-induced kidney damage. However, the effect of the curcumin on liver or kidney disease in humans still remains unknown. The following doses were used in clinical trials. For osteoarthritis, turmeric extract at 500 mg orally 2 to 4 times per day for 1 to 3 months. For allergic rhinitis or hay fever, 500 mg of curcumin daily for 2 months. For Crohn's disease, 1 gram daily for 1 month, then 1.44 grams daily for a second month. For type 2 diabetes prevention in people who had pre-diabetes, 750 mg of curcumin was taken twice a day for 9 months. For depression, 500 mg of curcumin was taken twice per day for 6 to 8 weeks, alone or as an add-on to the antidepressant fluoxetine, also known as Prozac. For non-alcoholic fatty liver disease, 70 mg of curcumin was taken daily for 8 weeks. For pruritus, 500 mg of turmeric was taken orally 3 times per day for 8 weeks, or a turmeric extract, the C3 complex of curcumin, standardized to 1 gram, which is mixed with black pepper or biopterin for increased absorption, was taken daily for 4 weeks. Turmeric is generally well tolerated. The common side effects include constipation, indigestion, diarrhea, distension, gastroesophageal reflux or acid reflux, nausea, vomiting, and other gut issues. Very rarely, curcumin can cause pruritus or pitting edema. Applied on the skin, turmeric may cause allergic contact dermatitis. In high-dose in vitro models, curcumin can cause cytotoxicity and DNA damage. At high doses, it's suggested that curcumin may actually induce reactive oxygen species leading to DNA damage. Cellular and animal research suggests that curcumin can decrease sperm motility and density. Curcumin may inhibit enzymes that are involved in the final step of testosterone synthesis. Its effects on fertility in humans are unknown, though. The same study states that because humans can consume up to 8 grams of turmeric per day without apparent side effects, consuming curcumin orally may not increase curcumin levels in the blood enough to inhibit testosterone synthesis. In vitro curcumin increases the L-RRK2 mRNA and protein. The L-RRK2 is a gene whose expression has been positively associated with Parkinson's disease. This could, in theory, lead to an increased risk of Parkinson's disease. However, the effects of curcumin on Parkinson's disease in humans remain unknown. Adding piperine from black pepper likely increases the absorption of curcumin in the blood. In fact, researchers have estimated that it may increase the bioavailability of curcumin by as much as 2,000%. Consuming curcumin with an oil was the traditional method of consumption, so adding a fat such as coconut oil, ghee, or butter may help to increase its bioavailability. You can see my other video on curcumin's role in cancer treatment for more information about this herb.